This is HQ. Please hit the like, share, and subscribe button. California and Illinois who joined the WHO network after the U.S. withdrew, or Donald Trump withdrew us from the WHO network. So, United States officially withdrew from the World Health Organization in January 2026. So that means the federal government no longer participates in the WHO meetings, no longer funds the organization, and no longer has direct access to its global health coordination systems. That's a big deal, a very big deal. Now, in response to that withdrawal, California and Illinois have announced they're joining the World Health Organization network on their own. Specifically, they are joining something called the Global Outbreak Alert and Response Network, which is basically an international system that tracks disease outbreaks around the world and shares that information quickly with its members. And that's a good thing because my understanding is we have a virus that is loose and they're trying to figure it out right now. So this is a good thing. So let's break this down. When there is a new virus emerging in another country, or a spike in something like measles, Ebola, or a drug-resistant infection, that information gets reported into global networks. Those networks help governments respond faster. They coordinate scientists, labs, travel, advisories, and sometimes emergency supplies. Before the U.S. withdrawal, the federal government handled that coordination. We handled that coordination. Now, states like California and Illinois are saying, if the federal government is not participating, we want direct access ourselves so we can respond quickly for our states. And that's where this gets very interesting. This isn't just about political theater. This is about preparedness. California has major international airports, so does Illinois. Chicago and Los Angeles are global travel hubs. People are constantly flying in and out from all over the world to those states. If a contagious disease breaks out somewhere overseas, those states are often the first point of entry. So here's the human question. If there's an outbreak in another country, do you want your state health department to know about it immediately or wait for information to trickle down through alternative channels? Supporters of the state's decision argue that joining the WHO network gives the real-time data and coordination tools that could help them respond faster. I, for one, am glad that they joined because I'm afraid something like COVID would happen again. So critics argue that states shouldn't be conducting what looks like independent foreign policy. They say global coordination is the federal government's job under the Constitution. That tension is real, but let's back up for a moment. The U.S. withdrew from WHO. Was it justified by the administration as a matter of sovereignty and dissatisfaction with how WHO handled COVID-19 and funding transparencies? This administration said the U.S. would pursue health leadership through other partnerships instead of WHO structures. That's the official reasoning. However, the WHO is not just about pandemics. It's about vaccination coordination, disease tracking, laboratory standards, emergency responses, and sharing technical guidance between countries. When the U.S. left, that created a gap. Now the question becomes, who fills that gap? The federal government says it will handle global health relationships differently. Some states are saying they don't want to risk losing access to international outbreak information while that shift happens. Now let's talk about Africa for a moment, because there is where the global impact becomes very real. Many African countries rely heavily on WHO coordination for disease surveillance, vaccination campaigns, and response systems. The United States has historically been one of the largest contributors to WHO's budget. When the U.S. withdrew, Funding shifts, programs adjust, technical support can become strained. Why should that matter to you sitting at home in America? Well, because disease does not respect borders. Disease does not respect color. Disease does not respect countries. If an outbreak isn't detected or controlled early in one region of the world, it doesn't stay there. International travel spreads it. Supply chains move it. Migration spreads it. We saw that with COVID. So when the global coordination weakens even slightly, the ripple effect eventually touches everybody. Now here's where a little speculation, responsible speculation comes in. We are watching something bigger than just a health policy disagreement. We're watching states begin to act more independently in areas traditionally managed by the federal government. Public health, climate policy, international partnerships. That could mean stronger state autonomy. It could also mean fragmented national strategy. If California and Illinois build their own direct relationships with international health bodies and other states choose not to do so, you could see uneven preparedness across this country. Some states might have earlier alerts, some might not have any at all. That creates variation in responses. And variation in responses can either be innovation or vulnerability. Another angle to consider is the funding. When the United States withdrew, it removed a significant portion of who's funding. If other countries don't fill that gap, WHO programs could shrink. That affects disease monitoring in lower income countries. If disease monitoring weakens overseas, early warning systems weaken. And if early warning systems weaken, global outbreaks can grow before they are detected. So while this story sounds bureaucratic, states joining a network after federal withdrawal, it's actually about whether we stay connected to global early warning signs. It's about whether your local hospital hears about a new outbreak early or late. It's about whether vaccine coordination and research partnerships remain fluid or they slow down. Now, does this automatically mean disaster? No, it doesn't. There are other global partnerships besides WHO. The federal government says it will maintain healthy leadership through different channels. But the fact that states are stepping in tells you something important. They are not fully confident that alternative systems will provide the same level of access. And that's the story beneath the headline, right? This is not just about politics. It's about information flow. It's about timing. It's about being prepared. And preparedness is invisible when it works. You don't notice early detection systems when they function properly, right? You only notice when something spreads too fast. So the real question for you as a viewer is, do you believe global health coordination makes America safer? Or do you believe national sovereignty outweighs international integration? That's the policy tension playing out here. For now, California and Illinois have chosen global network participation. Other states may follow. The long-term outcome depends on how effective alternative federal health partnerships prove to be, and whether international coordination weakens or simply shifts form. This story isn't finished, but it absolutely affects you because the next global health threat will not ask whether you live in a red state or a blue state at all. It will move based on speed, and speed depends on information.